All right, we're going to be talking about the PicoWay Resolve treatment. It's the next Resolve treatment for photorejuvenation with reduced discomfort, none to limited downtime, comparable results to Fraxel Restore. The handpiece, if you're not familiar with it, is a little bit different than the Zoom handpiece we typically use for tattoos and pigmented lesions. The spot size is actually a square with dimensions of 6 by 6 millimeters, and it's delivering 100 micropulses in a square pattern. The settings we're going to be using today are what are currently being used by Dr. Eric Bernstein and Dr. Errol Kovar. Again, we're using the 532 Resolve. We'll be covering the 1064 Resolve at a later time. The patient we are treating today, we'll call her Mrs. J, and she is a skin type 2. We'll be using 0.8 millijoules, performing 2 passes, and commonly for a full face you'll be delivering anywhere between 1,500 and 2,000 pulses. What we're going to be looking for is some slight gritting of the skin, some sort of slight frosting in a fractional pattern. If we start seeing it, I'll probably back off a little bit. If we want to be more aggressive, we can use the 1 millijoules or higher. You will see gritting, and patients need to know that the downtime will be 3 to 4 days. But again, they can they can apply makeup with no issues. Our patient here, Mrs. J, she's already cleaned her face. We wiped the area with alcohol. It's important that we always treat skin that has no foreign substances on there, no moisturizer, no sunscreen, no makeup, squeaky clean skin, as I like to say. All right, so the treatment will be starting here shortly. The settings that I've currently got it on, I'm going to bump it up to the 1 millijoule. They always say more is more. And I'm going to do a test spot and kind of assess the skin and look for the gritting pattern. If I don't see it, I'll continue with that. The repetition rate I've selected, and everybody does this a little bit differently from what I've seen. I personally like 5 hertz or 5 pulses per second. It allows me to have a little bit more control of the delivery of the pulses. I've seen some users perform this treatment at 7 hertz or even 10 hertz. But for me, again, I like 5 hertz because it allows me to have more control. I focus on treatment areas about the size of a business card, so you're looking at maybe a 2x4 square or 2x4 rectangle. I'll perform 2 complete passes before moving on to the next zone. Getting my foot pedal into position here. Getting the arm into position here. Mrs. J, are you okay?
Yeah.
All right. And again, everybody's got a different technique in how they perform these treatments. I usually focus on the middle of the forehead first, and then I'll turn the head one way, work my way around to the lower chin, and then I'll do the same thing from the other side, doing the left forehead all the way down to the middle of the chin. Another thing I want to point out, I know I previously mentioned that we have reduced discomfort. No patients should really require any sort of topical anesthesia. Personally, I've been treated with the 1064 at 1.9 millijoules, and as a man, we typically have lower thresholds of pain, and I was able to tolerate the treatment fairly well. So again, I'm going to manipulate the patient goggles. I'm going to perform a pulse or 2. And then I'm going to put my glasses on. I don't see any frosting there. So I feel comfortable continuing with this treatment. And again, I'm at 1 millijoule. 5 hertz, 532 Resolve handpiece. Another thing that when I instruct on the use of the Resolve handpieces and even the Zoom handpieces, I don't want to touch the skin per se. I kind of want to float just above it. which allows me, or prevents me from sticking to the skin and grabbing, which would then prevent me from continuing on with my treatment area. So, all right, Mrs. J, you ready? Just kind of glide across the surface of the skin. There's one pass. And there's two passes. We're going to stop and take a look for a second. I see no unusual tissue response. So at this point, I'm going to continue on. I'm going to turn her head to her left, and I'm going to work on the right side of her forehead. Again, it's important that you avoid treating inside the orbital rim and try to stay away from any areas that have any hair, like the eyelashes, the eyebrows. One pass. And two passes. Doing all right? Turn your head a little bit more. I just mentioned that you want to basically just kind of hover like 1 millimeter above the surface of the skin. You don't want to go too much higher than that, because unlike a lot of the other lasers we use for, say, hair removal or vascular lesions, with those devices, when you pull away from the skin, you'll defocus and actually reduce the amount of energy that you deliver. In the case of the PicoWay system, you'll actually pull it away, you'll actually make the beam delivery of the amount of energy coming out exponentially higher. I always like to stretch the skin a little bit, so sometimes, particularly around the periauricular area, you'll see some fine lines. You stretch those out, you flatten out the skin, and you allow for better delivery of the laser beam. On a scale of 1 to 10, 10 being the worst pain ever, what would you rate this?
2.
A 2. See? And that's without any topical anesthetic. Just a little bit. You may see me changing my directions. It really doesn't matter which direction you want to go. If you want to do vertical and horizontal on the 2 passes, that's perfectly fine. I've seen people do circles. It really doesn't matter so long as you're delivering 2 passes. Okay, get you to roll your lips in for me. Perfect. I'm going to treat the entire upper lip. right side. Because we're here, I might as well treat the nose a little bit. Now, I've actually seen some people comment that they've actually seen some improvement in pore size. So that's another indication that might be sold to customers wanting to use the Resolve handpiece. You can hear the snapping. That's the light changing the electrons in the skin, creating plasma, which is creating the light-induced optical breakdowns, or what I like to call LIOBs. You see me manipulating the nose a little bit. Again, I like trying to treat as flat a surface as I possibly can. All right, I want you to roll your lips in again. We'll tackle the lower chin. I don't know if you guys can see this on the screen. Mrs. J, I'm going to lift your head up a little bit. Can't really see it from the camera, but what I'm looking at right now is if I'm looking at the top of her face from her right side, there is some slight general erythema. Again, we have seen some patients respond with some very slight petechiae. That's usually gone in anywhere between 24 and 48 hours. Because we're not breaking the skin, that allows the patients, if they wear makeup, to actually put some makeup on to cover up any slight petechiae that's seen. And again, it does resolve after a couple of days. This entire treatment, and I think I might be moving a little bit slowly simply because I'm talking at the same time, although even doing so, I think I'm probably going to finish this treatment in about 20 minutes. And so most practitioners performing this treatment can do a full treatment in anywhere between 10 and 20 minutes. And again, that depends on how focused they are, as well as the repetition rate or that they've selected. Again, I missed a spot here on her right side. I'm going to move it over here. Again, we don't like treating with any laser light device inside the orbital rim without the use of intraocular shields. We're not using those in this particular treatment, but fortunately the skin's very stretchy, so you can pull the lower eyelid skin back over the orbital rim, and you can deliver a few pulses to it as well. All right. Turn your head to the right. may have noticed that I'm stopping at the jaw line simply because of time. I know there are a lot of customers who are actually treating the neck and the chest and the backs of hands. But just be aware, because of the nature of the skin, meaning that it's thinner, it's got different adnexal structures, which participate in the healing of an area that's been injured. You might see some increased likelihood of bruising. So patients need to be aware of that. But again, darn near any area that wants to be that a patient wants to have treated can probably do so. We're seeing, obviously, we're treating this young lady who has excellent skin, just for overall rejuvenation. If she had pigment, you'd see some reduction in the amount of pigment after a treatment, and again, more so after a second treatment, and even more so after a third treatment. People are using it for acne scarring. Some people are using it for, like I say, pore size, crepey skin. I haven't seen any any pictures, before and after photos of stria, but I've heard people are using it for that. I think just general scars, anytime you create an injury, you're going to get cleaning of the old collagen and formation of new collagen, which should hopefully soften the scar. Let's go try. All right, again, when treating off face, because of the thinness of the skin, you may need to reduce your energies considerably. Anywhere between 0.8 to 1.1 can be lowered to as low as 0.3 to 0.5 millijoules. Anyway, that is a PicoWay Resolve treatment. Hopefully you find this information beneficial. I'm sure Mrs. J has. And happy selling.